I've been an emergency physician for 25 years in the United States. And for all of those years, I worked in a level 1 trauma center, which is the highest level of medical care provided by a hospital. So we had 24-hour, all day, every day coverage for specialties such as neurosurgery and cardiovascular surgery and trauma. And so if there was anything that was a major trauma anywhere within a 300 to 400 mile radius, it might be flown to our center. That gives you an idea of the kind of critical patients that I took care of. And one such patient was a man by the name of Jeff Olson, and I bring him up because I can talk about him because he's spoken publicly about his medical condition, and he's a good example, so I'll start with him. He was involved in a car accident a couple hundred miles from our hospital, and in that car accident, his vehicle rolled over. It killed his wife. It killed his 14-month-old son. It trapped him in the car, and his 7-year-old son was minimally injured. And when they got Jeff Olson out of the car, they took him to a local facility, and then they put him in a plane and flew him to my hospital. And when I went into the trauma room, I was not his doctor. There were other doctors on duty, and they were taking care of him, but I was working in another part of the department, and I went into the trauma room to check on him, and his deceased wife was standing in the air above the gurney observing his care. And I communicated with her. I didn't know it at the time, but even before he'd been extricated from his car, Jeff Olson had actually had an out-of-body experience. He'd had a near-death experience where he rose up above the scene of the accident and communicated with his deceased wife, who told him, "You have to go back and raise our son." And I didn't know any of that. I just knew what happened, what I saw and witnessed in the trauma room with his deceased wife. And it was very much one of the experiences, an experience that you've heard described. There was this profound flow of knowledge, all almost instantaneously and without words. And I knew who she was, even though I'd never met her. And I knew who he was, even though we'd never met. And I walked over and I looked at his leg and I checked the pulse in his leg and I said, he's going to lose the leg. And I knew that because she knew it. And yet I knew that he'd lived despite his life-threatening injuries, and I knew there was something important for him to do in this life still. And all that happened in a few minutes, and then he went off to the operating room, and I went back out into the department and finished my shift and then went home and never expected to see him again. About a month later, a nurse who was in the department at the time and who actually also saw his wife, she had spiritual gifts and experienced it with me. She came and grabbed me by the arm and insisted that we go see this Jeff Olson in his hospital room and tell him what we'd seen, what we'd experienced. And I was less than reluctant, or I was more than reluctant, I should say, to do that. I wasn't interested in sharing my spiritual experiences with a perfect stranger. I didn't know that he'd had a near-death experience. But she was very persistent, and she drugged me up to his hospital room. And I reluctantly stood in the corner leaning against the wall and listened to the two of them have a conversation. And when it got to the part where she described what I saw, I kind of nodded reluctantly and acknowledged that, yes, that had happened. And Jeff Olson and I actually became very close friends, and we're still friends today. In fact, we speak together sometimes. And I had a number of experiences like that in the emergency department. I came into the emergency department one day to begin my shift, and before I even logged onto the computer, I sensed a spiritual presence. And for me, that starts as this vibration, if you will, almost this chill down your spine that you've experienced, I'm sure, and it radiates out into the extremities. And I realize it's different for everybody, but for me, when I have that feeling, it tells me that there's a spiritual presence. And I wondered who it was, and this woman was unconscious in the next room, and a team of professionals were trying to resuscitate her. And yet her spirit was communicating with me, asking me for help. And I had, like I said, I hadn't even started my shift yet. I had no responsibility for her care. I want to make that perfectly clear. I had absolutely no involvement in her medical care. But I walked around the corner and into the room, and I saw the professionals doing chest compressions and trying to resuscitate her. And she asked me if she could leave. And I don't know why she would ask me that question. I still to this day don't know why she'd ask me that question or what qualification she thought I had to answer it. But I walked over and I inconspicuously rested my hand on her leg, because I've learned over the years that touch is so important in these kind of spiritual communications. And so I wanted to be in touch with her physically. And nobody else even noticed me. They were all busy doing their jobs. And from some glorious place, the feelings, the thoughts that came to me that I communicated back silently to her was, if you feel it's okay to go, and if you think it's the right time, then it's probably okay. And at that moment, she rose up out of her body and stood in the air, and she looked about half the age of the body she'd just come out of. And this profound sense of peace settled upon me from her, and took me to a glorious place for a few moments as everybody else continued to do their job. And then she thanked me and she left. And I turned and walked out of the room, and as I'm leaving the room, I hear the physician in charge call out a time and pronounce her dead. Of course, I already knew that because I'd seen her leave. And one of the things that I loved about that experience, and it's common in both of the experiences I've just shared and in others I've had, they're always profoundly grateful. No matter what you've done, no matter how small it might seem, they're always grateful for the people that have had some role in their life, in their mortal life. They're totally at peace. Now, I know that there's some reports of people that have had unpleasant experiences. I haven't encountered that personally. I don't doubt that those things exist, but I haven't encountered those kind of experiences myself. So I haven't been near death personally. I haven't had a catastrophic trauma like some of my patients. And in my book, I talk about what I call near-life experiences. Because when you talk to these people, and when I've had these experiences myself, it feels more close, more real, more alive than at any other time in my existence or in their existence. They're closer to this divine, foreordained life than they are any time else in mortality. And so I think they're nearer to life than they are to death. And when I've had these, when people are injured or when they're really ill, there's all kinds of suggestions about what might cause these near-death experiences. You hear people talk about an anoxic brain, or a temporal lobe seizure, or neurotransmitter release. All these kind of proposed medical explanations for what happened, what they experienced. But when you actually look at them, none of those proposed mechanisms really holds up to scrutiny. My friend Bruce Grayson is a psychiatrist. He's an MD at University of Virginia, head of Department of Perceptual Studies. He's been studying this for decades. He was one of Raymond Moody's mentors when Raymond Moody was a medical student there. And I've spoken with Raymond about a lot of this stuff as well. None of these mechanisms really hold up to any kind of scrutiny. And yet the physicians continue to hold on to them and dismiss them. But here's the interesting thing. What I described to you is what we know as a shared death experience. And I'm seeing these things and I'm perfectly awake and I'm perfectly healthy. In fact, as I said, the one experience occurred before I even saw my first patient that day as a physician. And after it was over, I logged into the computer and I worked an entire shift and then went home. So it's hard to blame my experiences on an anoxic brain or a seizure. And so I think sometimes these shared death experiences are at least as powerful or even more powerful perhaps than some of the other near-death experiences. The real question for me isn't a medical one. In fact, Jeff Olson, about 10 years after his accident, finally decided to speak about it and talk about it and write a book about it, which he did. And he was asked to be on a TV show, and the producer of the show wanted one of his physicians, i.e. me, to come on the show and testify as to how dead he was, or nearly dead. And I looked at Jeff and I said, if that's their focus, they've already missed it. They've already missed the value of the experience, because the moment you launch into a debate about how dead do you have to be dead, or how long do you have to be dead to qualify, or what actually constitutes death, then you're off in the weeds. What really matters is whom did you communicate with, what was communicated, and what are you going to do about it and with that information now? How are you going to make yourself and your life and those around you and the world better by the gift of knowledge that was given when you were outside your body? And I've been out of my body a few times. I've been in the presence of the divine a few times, even though I haven't been clinically dead. So I relate with the people I talk to about these things. The challenge is, what do we do with that knowledge, and how do we help others around us? On one occasion, you asked at the beginning, let me take a little diversion. You asked at the beginning of this some questions about what do professionals do? How do they function? How do they talk about these things with their colleagues who may not be very receptive to the notion? I have a number of people ask me, how do you reconcile what you've experienced with your medical knowledge? And for me, the answer is very simple. I've never sensed a contradiction. For me, there's nothing to reconcile. I went to medical school. I gave up a decade in the prime of my life to medical training, and I see that as trying to better understand and care for the physical body. None of that precludes having a spiritual component as well, having a consciousness. And I see myself now still as a healer, but I help souls heal rather than just helping their bodies. Because there's a lot of people that are wounded in their soul, wounded spiritually, and I try to help them now. You know, my friend Eben Alexander, you may have heard of, he's a Harvard-trained neurosurgeon. He had his near-death experience when he had a rare form of bacterial meningitis, and he was in a coma for a week. And mind you, this is a neurosurgeon who is a materialist, who believes that consciousness is a construct of the mind. It exists because the brain creates it. That was his mindset when he went into this. When he recovered enough and he was well enough to study his own medical records, he concluded that consciousness exists in spite of the brain, not because of it. That his brain was far too sick to construct the experience he had when he was in a coma. And he's got a couple of New York Times best-selling books that you're probably familiar with. So he's a pretty hardcore, highly educated scientific skeptic at the outset, and now he is traveling the world teaching people mindfulness, understanding, and his position is that the brain is actually a filter for that eternal part of us that's the soul or the spirit or the consciousness, and it helps us function in this life by, in some ways, protecting us from too much knowledge too quickly and allowing us to gain it as we go so that we can grow into it, which is my position as well. I think our physical bodies, from my experience, function as a veil, if you will, that helps us not have too much knowledge that we can't handle until we're ready for it. And as we grow and learn and experience, then we're ready for a little bit more. For example, I walked into the emergency department one day to start my shift, and one of my physician colleagues was in a room trying to resuscitate a woman who had drowned in a hotel pool. And I walked into the room, and again, this is an example, I had no responsibility for her care. You see, I think when we get too caught up in the earthly, in the temporal, if I'm doing a trauma and I'm barking out orders and I'm trying to intubate somebody and keep them alive, my mind is completely engaged in things physical. I rarely have a spiritual experience when I'm doing that. But when I'm not caught up in those things, when somebody else is taking care of all of that, and I walk into the room, I'm open and I'm receptive, and this woman had just exited her body. And she was just kind of catching her bearings. She was just kind of getting a feel for what it felt like to not be encased in this human form. And it was a really fascinating experience with her. And then a moment later, she was gone. She just wasn't there anymore. And I thought, where did she go? And I looked over at the monitor, and she had a heartbeat again. They'd actually successfully resuscitate her. She wasn't gone. She was back in her body where I couldn't really sense her presence so clearly anymore. These bodies we have, they function to buffer us and protect us. And when we're out of them, we see more clearly and we hear perfectly and we discern things, and knowledge flows freely and openly, and it's an exhilarating experience. I think one of the reasons it happens perhaps more in healthcare than in other places, this is how I view it. This is the metaphor I use. Imagine yourself in a room that's kind of a little bit dark. It's not black, but it's just not bright. It's kind of gray. And on your left side is this huge, dark, heavy curtain. And beyond the curtain is this bright, glorious light and this army of people that you can't see. And on the other side of the room, there's another curtain just like it. And again, on the other side, there's this glorious realm where these divine beings live, and you can't experience it. But every once in a while, the curtain on the left draws back a little bit, and a person enters the room, i.e. they're born. And if you're close by, and I use this example because I've had at least as many spiritual experiences when people are born as when they die. If you're close enough to that veil or that curtain when it gets drawn back, some of that glory and light spills onto you. And when I say close, I mean spiritually close, not necessarily geographically close, but geography helps too. And on the other side of the room, every once in a while, that veil is drawn back, that curtain's drawn back as somebody leaves. And if you're there, sometimes you get to see participate in some of that light. And sometimes you can even look through that opening in the veil and you can see into there. You might even see somebody you recognize that's preceded you in death. And that's the metaphor I use. And that's why I think these experiences are frequent in the emergency department, because a lot of souls are coming and going. And we don't always pick up on it because there's a couple of things that really impede our spiritual sensitivities. One of them is profound joy, interestingly enough. The kind of joy we experience when we have a child that's born. I just got a new granddaughter 3 weeks ago. And she came through that veil into this life. And sometimes when we're so caught up in the earthly joy, we miss the spiritual experience as well. And the same's true at death. One of the other things that really impedes our spiritual sensitivities is sorrow and grief. And if somebody we don't know, that we're not connected with, dies, sometimes we have a wonderful spiritual experience, And sometimes if it's somebody that's so close to us that it just really wrenches our heart, sometimes we don't have those spiritual experiences because we're too overwhelmed with earthly emotion. So people ask me, why don't more people have experiences like mine in the emergency department? And that's my answer, is because if you're too closely connected, sometimes it really impedes the spiritual sensitivities. So one thing I've found that's very important, and you can all do this, if you're near a loved one when they're approaching death, or you're actually there when they die, which is becoming increasingly frequent as we use more hospice care and help people pass with more dignity and in the presence of their loved ones. When somebody dies in the ER or in the hospital, there's this tendency to pronounce them dead, call housekeeping, move on to the next patient. It can get mechanical. It's unfortunate to admit, but it can. And I found that when somebody dies, instead of just moving on in this mechanical way, if I stop and pause, even for just a few seconds, just for a minute, and acknowledge, wait a minute, a human soul just transitioned, and take a deep breath and pause for a few moments and wait. And oftentimes that's all it takes to open yourself up to have a spiritual experience, to have somebody communicate with you. I started to say talk to you, but of course they don't talk in the same way, and you don't hear them the same way. People very frequently ask me, so did you see him with your eyes? Well, how do I answer that, right? Eyes are a mortal thing. Eyes are something that take physical signals and transform them into electronic impulses that the brain interprets. But the image is literally generated in your brain. And in a spiritual sense, I kind of think of it this way. In a spiritual realm, things just bypass your eyes and go directly to your consciousness or your spirit. They bypass that veil of the mortal flesh. And so the word I use when I talk about my spiritual experiences, sometimes I use the word see or hear, but most of the time I use the word experience, because it encompasses more completely what's happening. When I saw Jeff Olson's wife in the trauma room, for example, she's standing in the air above the gurney, looking down on him. And yet I can see everything beyond her, as well as seeing her. But it wasn't like she was transparent or translucent like you see depicted in movies. It was just, she had form, there was matter, some spiritual matter constituted her being at the time, and I could see it, but I could see what was on the other side of it at the same time. And when I walked over and looked down at Jeff and felt the pulse in his leg, I could see him in front of me, and yet I could still see her standing above and behind me in the air, because I could see in all directions at the same time. So when people ask me if I see it with my eyes, I guess the short answer was no, it's kind of different than that. But sometimes it feels the same as seeing something with your eyes. And the point is this, I think, and this is what I try to help people understand, is you have to come to the point where you have confidence in your experience. I can't tell you how many people start out their conversations with me telling me about their experience, and they start off by saying what they didn't have. People all the time will say, "Oh, I didn't see anything. I just knew they were there." Or they'll say, "I didn't actually hear a voice. I just got the message. I just felt it." And they say it as though feeling and knowing were somehow a consolation prize. Whereas I know that feeling and knowing are spiritual senses. That's how spirit communicates. If you think about it, think about the times in your life when you were really driven, when you were really compelled. It wasn't because of something you saw or heard usually. It was because of something you experienced in your soul that drove you forward. Those are very powerful, and that's the way that non-physical beings communicate, in my experience. Does anybody have any questions that they want to ask before I go on? Wendy, do you have anything?
Jeff, can you tell us about your books, first of all? And then I'd like you to tell us about your work today, your creative work that you're involved in, with your sculpting and your painting and everything else that you're doing.
Sure.
First, the books.
Yeah. I usually forget to talk about my book. And so Wendy gave me a prompt before the rest of you got online, asked me if I had one of my books. So I have one of my books. This is the book that I'm referring to. It's titled Not Yet. It's available on Amazon in Kindle as well as print. And it's a memoir of some of my experiences in the emergency department over the last 25 years. And much of it is the first year of my friendship with Jeff Olson, because we had some marvelous shared spiritual experiences. I also wrote a novel. I don't have that one with me. It's titled Who Buried Achilles? And it deals with spiritual things from a different perspective, from a fictional perspective. Because when I wrote it, I wasn't willing to take ownership of some of my experiences. And so it's about a really gritty character who's angry at the world because he's been treated so poorly, but ultimately it's a redemption story, and it's based on a lot of spiritual principles. And it's also on Amazon and Kindle, Who Buried Achilles? And then I did a series of 6 children's books, which were inspired by my grandchildren. All of these books, as well as my paintings and my sculpture, bronze sculpture that I sculpted, these are all available on my website, jeffodriscoll.com. And I recently reworked my website and got a new domain name, which also goes to the same website. It's called helpingsoulsheal.com, because that's what I'm doing now. When I didn't talk about any of my experiences for about 20 years. It just, for some reason, it didn't feel comfortable. And then a couple of years ago, I woke up one morning and it just, for some reason, felt like it was okay to talk about these things. And so I talked with a few select small groups of people. And a few months later, I'd written my book. I wrote it that quickly. I'd been stewing on it for 20 years. I didn't have to do much research. And when I started sharing my book and sharing my story, I had so many people come up to me during or afterwards and talk about their experiences and how much they benefited from hearing me talk about mine. And I realized that I could help people. And when I'd have one-on-one conversations about my book, those conversations inevitably evolved into a conversation about spirituality and spiritual gifts. And people would ask me about my gifts. And I noticed that they asked me in such a way as to almost suggest that they had no gifts of their own. And yet as we talked, I'd help them discern their own spiritual gifts. And they'd share things with me, and I'd turn the mirror around on them and I'd point it back at them and help them recognize their own answers. And as I did that a number of times, I realized that I could help these people. And so now I do personal one-on-one spiritual mentoring with people, as well as workshops and speaking engagements to help people with this. Let me give you just one example that was really powerful. I met with a husband and wife. Usually I meet with people one-on-one, but on this occasion I met with a couple. And they were 5 years out from the death of their son, who was 20 years old, who had an overdose. And they felt like they hadn't really had any closure or ongoing connection with their deceased son. And it troubled them. And they were really, it was really uneasy for them. And we talked for a while. And about an hour into the conversation, the father, the husband, starts to tell me about a worship service they'd been to. And he said afterwards, he said, I don't know exactly what happened. He said, it was like a dream, but I was wide awake. And my son came to me. And we were in this big, elaborate, beautiful train station. And we walked over to the counter and he bought a ticket. And he looked at me and he said, Now I can go places I couldn't go before. And then he started talking about something else. I said, whoa, wait a minute. I said, if somebody you didn't know came to you and described that experience, what would you call it? And he thought for a while, and he was really hesitant, very tentative. And he finally said, a vision? I said, okay. And this is an example. I turned the mirror, if you will, back to him, and I said, so your son came to you in a vision, and he told you he was okay. And he said he can now go places he couldn't go before. And as I looked at this father, he just started to weep. And he looked at his wife, and she started to weep. And they realized, oh, that was real. See, you have to learn to have confidence in spiritual things and accept them and own them. And once they saw that as real and accepting it, then it was so profoundly healing. And I knew, I understood it because I'd been having visions for 25, 30 years, maybe more. On one occasion, I was in rural Utah, and I suddenly felt myself going through this physical veil, if you will. I could feel it going past my face as if I was passing through some white, airy drape of some kind. And at the same time I'm experiencing this, at the same moment, I'm standing 10 or 12 feet away, observing it as though it were happening to someone else. Now, I know that's not possible in our realm to experience it and to observe it independently at the same time, but that's what happened to me. And as I passed through this veil, I was walking through this lush grass in my bare feet, and the only thing I had in the entire world was a pair of blue jeans, a belt, and a button-down collar shirt. And I was walking, and I was profoundly happy. And I was keenly aware that I had nothing, that I wanted nothing, and that I missed nothing. It was so liberating. The first time I ever referred to that as a vision was when I was writing my book, and I was forced to find some word that I could use to talk about something that I had refused to talk about. See, once you call it a vision, then you're kind of on that precipice. Wait a minute. Only nut jobs and prophets have visions, right? So I must have had something else. And that's what we tell ourselves over and over again. And the consequence of that is we build these big barriers between us and what we really want, what really heals us, what makes us understand our divinity. When we begin to understand who we are, then we're more willing to use the words. So I'm in the ER one night, and I walk into a room. It's kind of a cold autumn day. There's some snow on the ground, but it's not bitter cold. And I walk into this room, and the patient is sitting on a gurney, and he's disheveled and long hair and beard and kind of malodorous, if you will, kind of that stale, musky, unwashed smell. And he was a homeless gentleman. And we were the only two people in the room. And I looked down at his shoes, which had holes in them, and through the holes in his shoes, I could see the holes in his socks, and through the holes in his socks, I could see his feet, and they were not in great shape because he'd been walking around in cold, wet socks and shoes for a long period of time, and that's not good for your skin. And I knew what needed to be done, and he knew what needed to be done. And I turned to the sink, and I pulled a wash basin from under the sink, and I started to fill it with warm water, and there was a paper towel dispenser, a chromed paper towel dispenser there. And I looked into it, and I could see his distorted reflection in the paper towel dispenser, and I could see the apprehension in his eyes. And I took this wash basin full of warm water and I squirted some soap in there and I sat down at the foot of the gurney, and he sat up to start to take his shoes off, and I could tell it was really uncomfortable for him. I don't think I even said anything. I think I just gestured to him to lay back on the pillow, and I undid his laces and I gently removed his shoes and the threads of what left of his socks, and I put his feet down into this wash basin and I started to wash his feet. And I saw who he was. I saw his divinity. I saw that noble portion of every soul that suffers in this life. And I knew who he was. And when I wrote it in my book, I think I wrote that I saw God. That's what happens when we start to realize not only who we are, but who our neighbor is. And when we start to realize that, then we can treat them appropriately. And it starts to become more natural for us. And so one of the things I try to help people with when I meet with them one-on-one is I try to help them understand and recognize their own divine nature and why they're here. And when I went for my first speaking engagement after I wrote my book, I was in the airport. A friend of mine had arranged for the speaking engagement, and I had a stack of my new books in my suitcase, and I was sitting in the lounge waiting for my plane, and this young couple came in and sat down next to me and started chatting. We had the inevitable, where are you going, what are you talking about conversation. And when this young woman found out where I was going and what I was going to be speaking about, her face just lit up. She said, my grandfather just died, and he's come to me a couple of times. And the first thing that passed through my mind was, I'm this really closed-mouthed guy that never speaks about this stuff for decades, literally. And I'm thinking, I just met this woman and she's telling me these profound, personal, spiritual things. And then it just came to me. I was given what to say. And I looked at her and I said, have you ever asked him what he wants you to do? And she just, her whole countenance changed. She knew somehow that was the right question. And I knew it because I'd learned it by then. In fact, I write about this in my book, about this question. She took one of my books and she left a different woman, took her husband. They got on the plane, went wherever they were going. I got on the plane to Boston from Salt Lake to go to my speaking engagement. And I'd been an emergency physician for 25 years by then. I estimated that I'd taken care of in excess of 60,000 patients. And on the plane between Salt Lake and Boston, this voice that I've come to know over the decades spoke to me and said, you will help more people with this book than you helped as a physician in the emergency department. And so that's changed how I feel about sharing my experiences, because I finally realized, with perhaps a few exceptions, my experiences were given to me to enable me to help other people. And I can't help them if I don't share them. So that's why I'm doing what I'm doing now, to try and help people heal.
Jeff, that's absolutely brilliant, Jeff. Thank you. Now, I'm going to call upon Jane Bisler to ask a couple of questions, because this is an area that she's been working in. Jane?
Oh, thank you, Wendy. Gosh, Jeff, thank you so much. It was, I really, really enjoyed what you had to say today. It was so helpful and so meaningful. I do have a couple of questions. At some of them you answered during your presentation, which I loved as well. When you were, so I think I understand that you're not doing work currently as an emergency room physician. Is that correct?
That's correct. Yes, I'm not seeing patients right now.
Okay. Well, you're seeing patients. They're just not in the emergency room. So I wanted to know, I know you went to your friend's room, your now friend's room, when he was in the hospital, to share with him that his wife had made an appearance over his body when he was there. What prompted you to do that?
The only thing that prompted me was this persistent nurse. that drugged me
Ah.
up there, kicking and screaming against my wishes. She was a very spiritual person, and she was about the only person I'd spoken with in the emergency department that I had shared some of my experiences with. And so when we witnessed Jeff's wife together, she knew that I'd experienced it. She was there, and she insisted that I go. And I didn't understand why at the time, but when I was actually in his room, as they were talking, Spirit spoke to me and made it very clear that Jeff Olson and I would be good friends for decades in the future, and that we would do things together. And that knowledge came to me as I listened to this nurse and Jeff Olson talk about spiritual experiences.
From that time forward, did you feel more comfortable then sharing your experiences with other patients?
Gradually. I shared a little bit at a time, and slightly more insecure environments, if you will. For example, I would have never contemplated doing a Zoom call a year or so ago. That would have never been on the table. I started out by sharing one-on-one with people, and I could spiritually discern that they were a good person to talk to, or that I had something to offer them, or that there was value in our conversation. And so I was willing to venture into that and be a bit vulnerable. And then the groups I started speaking with gradually got larger until I felt more comfortable speaking freely.
So in hindsight now, do you have a wish that you would have shared more of this with your patients in the hospitals?
No. And that's a strange answer, but the reason I say it is because I honestly believe in divine timing, if you will. I don't think I could have shared much of what I experienced with very many people at that time. It didn't feel right until a couple of years ago, as I said, is when it finally started to feel right to share. And I'm a firm believer that you have to follow your heart and be true to the direction you receive. Somebody asked me with my tutoring that I do now, with my mentoring spiritually, somebody asked me, do you regret being an emergency physician? And I said, oh no, that 30 years is what made me who I am now. That's what enabled me to do what I'm doing.
And you don't believe that the trauma that was going on in the emergency room really allowed those experiences to come through for you in a greater way than perhaps they would today with the work that you're doing?
I think the traumatic experiences in the emergency department greatly facilitated my experiences, my abilities. But that's not where it started. I never thought of this as a gift. I never thought of it as being unusual, as a matter of fact. All the time I was growing up, and when it was happening to me, I just thought that it happened to everybody. And it wasn't until I started sharing my experiences and people started coming up to me afterwards and saying, oh, how did you get this gift? When did it start? And they'd ask me these questions, and it forced me to think about it. And then I finally concluded, it started when my brother died. When I was 11 years old, my brother was killed in a farm accident. And I thought I got through that unscathed, not really having much of an effect on me, even though my brother and I were very close. And it was 20 years later, my brother came to me and he said, you need to go visit with our mother because there's things she's never told you. And so I went to see my mother, and she told me at that time that she always knew where I was in the house before my brother died because she could hear me singing. And after Stan, that was my brother's name, after Stan died, she said I stopped singing. So it must have had a primal effect on my soul, more so than I realized. And I had experiences through my teenage years of messages coming to me. On one example, I was driving, I was 16, I think, at the time. I was going 60 miles an hour. What's that in kilometers for you guys around the world? About 90 kilometers an hour or so. And late at night on a narrow, windy road, not as narrow and windy as the roads I drove in Essex and Sussex when I lived in England for a couple of years, but it was a narrow road. And a voice spoke to me and said, you need to slow down. And I hit the brakes and I came around the corner and I met a pair of headlights that belonged to a huge Cadillac.
Wow.
I was in a Volkswagen. And no one was hurt, but there was a lot of damage. And I think if I hadn't have heard that voice and slowed down, I might have been killed that night, because I certainly wasn't wearing a seatbelt.
Yeah.
And I thought about that recently. I thought, what? Somebody told me they thought that voice was divine, and perhaps it was, and sure it was in a way. But I'm thinking, in those teenage years, I was very rebellious. I wouldn't have listened to my parents or any other authority figure, and I don't think I'd have listened to God if he just sat in the seat next to me. But there was one voice I would have listened to, and that was my older brother, because we were so close. And that voice just wrapped itself around my soul, and I listened to it, and I think it was my brother. And so certainly my experiences in the ER refined and expanded my gifts, my abilities, but I think they started before I was even a teenager.
Not bad. I'm so sorry about your brother. It had to be really hard for you.
Harder than I realized. I didn't think it was that hard. It wasn't until much later. In fact, one day I went to a friend's house. She's a physician, and her husband was a physician. They had a pretty good income, and they obviously were much more comfortable with debt than I was. I'm sure they must have a huge mortgage, but they had this huge palatial home. And I remember coming home thinking, man, I'd like to have a home like that. And then I started thinking, no, I don't want to have a house like that. I don't want to care about anything that much. And I remember thinking, I don't want to care about anything, person or thing, that could hurt me by leaving. And I was looking at my computer at the time when I had that thought, and I pushed back from the computer. I think I said it right out loud to myself, that's not normal. And that was the beginning of my realization that I had some attachment disorder, fueled by the departure of my brother. And so I've, in recent years, been working through that and learning to be more vulnerable again. That's why I think that's one of the reasons I didn't speak about it for 20 years, was because these things were sacred to me. And the thought of somebody ridiculing them or putting me down because of them, I think my ego couldn't handle that. And I didn't realize that cutting ourselves off from being hurt means at the same time cutting ourselves off from being loved. The vulnerability is crucial, and so I'm coming back into that now.
Right. You would say ego, I would say inner child. The inner child didn't want to be hurt, but tomatoes, tomatoes, perhaps. Well,
my
I
inner
think we have
child
lots.
is pretty wild.
We have lots of inner children. I also wanted to ask, do you receive spiritual guidance in the work that you're doing now with your clients, patients? I'm not sure what you call them at this point.
I feel that I do. On almost every occasion. In fact, at this point, I don't think I can identify an incident when I didn't have an experience during my mentoring. I take it very seriously. When I get a request from somebody and they share some of what they want to talk about and stuff in advance, I literally fast and pray about it. I meditate about it and try to get some direction. And in every instance when I've met with people, I felt like it's been given me what to say. And sometimes it's stuff that surprises me or that makes me uncomfortable, but it's exactly the right thing. And when it comes out, I've seen people's lives transformed as a consequence. For example, I told you about the question, what do you want me to do? I learned a long time ago that there's two really critical questions that help us in our spiritual journey. When you have a spiritual experience, whatever that means for you, if it's vague and non-specific, I invite you to ask this question: who are you? You might not always get an answer, but sometimes you will, and sometimes it'll be profound, and sometimes it'll make the message clear. And the second question, what do you want me to do? And the reason that's so critical is because these people, and I call them people, I think of them as people. They're disembodied, if you will, but they're still souls, they're still beings. And they're so respectful of our lives, of our agency, our right to choose, that they won't interfere sometimes unless we invite them to do so. And so ask these two questions: who are you, and what do you want me to do? And sometimes that vague, impersonal spiritual feeling will be transformed into something that's intimately personal and profoundly actionable. And I shared that with a woman in a mentoring session just a few days ago, and I got an email from her 2 days later. She was alone in her home in a quiet time, and she felt a spiritual presence, and she asked the first question, and the person introduced themselves by calling her by name and introducing themselves as her grandmother, whom she'd never met in this life.
Wow.
And then she asked, what do you want me to do? And she was given some very specific instructions. And she sent me this in an email just a couple of days after our session.
Oh, that's beautiful. That's beautiful. Thank you so much for answering all my questions. I don't want to take up all the time, but I did want to say congratulations on your new grandbaby. How fun to have a new one in your life.
Yes, it's wonderful.